We make dental billing and insurance easier to understand. Subscribe to stay updated and help us grow the channel.
Talk to me about the state of case acceptance today. And have you picked up any new tricks over your time teaching teams?
That's a great question. And the answer is yes, because I think we've had to do things differently. Things that worked 5 years ago is not the same. I think our teams are different. Our patients are different. I think patients are, dare I say, well, they've done the Google search on so many things, which
Oh,
makes
yeah,
them an expert, they think, right?
absolutely.
And
Everybody
so
has a Google dental degree, right?
absolutely. Like, it's so easy to get, right? I mean, and what's so funny is you will see, I have seen patients in the chair reach for their phone when the doctor says something and start Googling it. It's like you have the doctor right there looking
And
at your x-rays and your picture, but you go ahead and Google that and see what you think.
I'm just thinking, like, say you and I were in an office, a physician's office, and you just got a diagnosis of something cancer.
Right.
And would you be like, hold on,
Let me
let me
verify.
look this up.
Yeah.
I don't know about that, doctor. Like,
No.
what the heck?
Yeah.
Who does that?
Who does that? But they think that, I don't know, I think people are hard to trust. And so if the doctor has not done a good job of building trust and they just came in there randomly, patient referrals are usually you've already got a level of trust with them. So that helps. And then I think it's just so easy. We have our phone for everything.
Mm-hmm.
And it's
Mm-hmm.
easy just to go, well, let me see what they say about it. Well, who are they?
Right?
I mean,
I
you're
know.
sitting here with me, the expert, but yeah, so that's different. And I think our teams are different. And in a time when a lot of practices are short staffed, I've
Yeah.
never had to do case presentation before. But now we don't have someone dedicated to doing that all the time. So guess what? Assistants or admin team, you might have to do something that you've not done before because there's only 4 of us or whatever it is.
Right.
So learning how to get comfortable having those conversations has
Well,
been
and all it takes is a week or two of not presenting treatment to realize like what an impact somebody that does present treatment has. I mean, so say you've got somebody who's out on, medical leave and you can't help it. You can't find anybody. Like it becomes really obvious who, maybe that little extra nudge or that little extra explanation would have made a huge difference, but we don't realize it until that person's gone. And heaven forbid that a doctor who got really comfortable with the team doing the case
okay.
presentation part has to do it. Oh boy, that's a whole nother like reacquaintance
No kidding.
with patient conversation.
No kidding. I have a doctor going through that right now, and he's like, "What?" I'm like, you're up. It's you again. You're the show, and you got to go in there and put a bow on it, ma'am. Your
Yeah.
team is she's moving, getting married and moving. I mean, what are you going to do? So until we find somebody, it's you.
Let's talk about that. Do you suggest that he just or she just spend some time going through the whole like history with the patient, the case, or do you suggest like they pick some of the easier patients to sort like cherry pick the patients to get started with? I'm thinking, my goodness, my doctor, he's good at it, but he doesn't want to do it. Like he would
No,
be very
that's true.
resistant if we said you got to cherry pick.
Yeah, and it's interesting because like I'll take the easy one and you think it's a slam dunk. And sometimes those are just as hard as a $50,000 case.
Yeah.
To present $1,000 for this one crown can oftentimes be harder than that $50,000 case. So one of the things I tell my teams all the time is it's not about the dollar amount. What's the impact you're going to have on that patient? What are they looking for? What problem are you going to solve for them?
Mm-hmm.
That's just the price tag, just how much it's going to cost to help them get there. If they can get buy-in on this other stuff first, hey, we've got options to help you pay for that. And teams just have to practice it. They've got to practice it and not be afraid of it.
So when you're training, is it better to just train them on how to get the clinical piece across? Or do you train them to do it all in like one cycle? And I don't know if I'm being clear here, but like, because this is what I've seen in different offices. A doctor will do the case presentation, nothing about the money.
Right.
Okay. And then they're out and then the money, the closer comes in,
Yeah.
and hopefully they're not totally like a used car salesman, but you know what I mean. But nowadays, are you seeing more like we've got to be good at everything, or, what is the best tactic? The split up or everybody doing it all? What do you think?
Yes, and because I
Okay.
think a lot of it depends on the talent that you have in your building with you. And some people can learn it and do great at it, and other people may want to do it, but they're not there yet. And one of the big things, and I'm a big believer in the doctor, when they're doing their treatment presentation, they're also buying you and trusting you. You're the expert. It's okay to say it's going to be around. Just shoot a little bit high so that when they actually talk about the finances, it comes in a little lower than that. Nothing worse for you to say, oh, it's only going to be 5,000. We put in the treatment plan to figure out the finances and it's 7,500. Well, now I'm the bad guy.
Right. Well, the
So
doctor
shoot
said
high. I know doctor
that,
said 5.
and that's the number they're going to have in their head. Like
Well,
they're
that's
not going
the
to
only one
understand.
they remember. Yeah.
Right. Right.
So just teaching doctors how to ballpark that for what they're doing on those big cases, especially not for a crown necessarily, but hey, if we're going to do some implant retained dentures, you're probably looking at about $60,000. That way the patient knows it, the doctor knows it. Now we can see if we're in the same ball field.
Okay.
Then I can go down for that. But then, yes, the assistant, here's the thing. An assistant can do these treatment plans and financials. An admin person can do it. I have hygienists that do it. It just all depends on where the strength of that person's communication skills are and what they're working on and learning. Now, hygienists, don't freak out. You typically don't have time to do it anyways.
Right.
But
Right.
you could, if you didn't have a patient. But you can hand that off to your next team member with confidence as well. And that's the other piece of that. So don't think you're going to have to do it, hygienist. But assistants, I have several really good that that stays with the assistant and they wrap the whole thing up, the financial
Yeah.
arrangements, make that next appointment. I mean, they're good. They're good at
Yeah. And they hear the whole thing.
it. I know the
So,
whole
and
thing.
years and years of listening to the rationale of why we do the treatment has made them so strong. I mean, I've said this a million times. Insurance coordinators, some of the best ones are assistants because they know the whole clinical cycle. But let's walk through that initial conversation that the doctor has. So they did well, first of all, I guess it starts with the comprehensive evaluation too. Are there things that he or she is doing during that helps with the next step in the process? I mean, what does a good comprehensive evaluation look like?
Yeah. I will go back even further to the
Okay.
first time they call the office.
Okay.
Is where patients begin to say yes. We're in yes mode if they have a good experience on the phone.
Right.
Our business team is confident. They help them. They address the initial questions about time and how much money and what about my insurance kind of stuff. That's where that yes starts. And then when they come in the office, we meet that with that same high level of service and build relationship first and talk about the treatment that that patient needs with confidence. Those are all where it starts. So then that is that comprehensive evaluation where we've got to do all the things, guys. That's full medical history, blood pressure, x-rays, photos, wellness scans. I mean, you do all your stuff and then tell the patient what you found, the good and the areas of concern. And when we're doing that, though, you've got to start with relationship. What's important to that patient? So
And that,
actually, turn around, mask down or off, gloves off. Tell me, Teresa, what's the most important thing for you? What are you looking for? I don't want to drive just my agenda to help them get healthy, but if I know how they're motivated, whatever they need, we've got a solution for. But if I don't ever ask them what's important to them, I could miss the mark on that.
I do think sometimes doctors, they do ask it, but I don't think they realize how important it is. And let me explain. Sometimes the patient intake form where
Yes.
you say, what is it that you would like to change about your smile, or what's your favorite thing about your smile? Some of those questions, the doctor will just read it,
Yep.
and it's like background information for him or her, but it doesn't come up. And so, oh, this is an interesting answer to this question. And it's just like when you go to any medical office, Angela, we fill out all that paperwork and I don't think anyone reads
I
it.
don't know if anybody read it.
Yeah. So just letting me know you read it is I'm already super happy. So, but
Yeah, absolutely. And you can turn around and all you have to say is, tell me more about this. You don't even
Yeah.
have, it doesn't have to be a hard question. Just tell me more about this. This is how you answered that. Tell me more about that. They're going to go, oh, they're actually looking at that. How to,
Yeah.
so that's really good. And then, asking, what do you want? What are you hoping for? Do you have any concerns? And most people, unless they have a lot of problems, are unaware of the potential problems that they do have. And that's
Of
where we
course.
come into play. That's why we're the experts. That's why
Yeah.
they're there to educate.
And I do think when you ask questions like, what are you looking for? What do you expect? Like sometimes the people that answer that in a certain way, you already know how to handle them. Because if somebody's like, I want to smile like Miley Cyrus and all that, and you're like, oh, no, we got a long way to
Yeah,
go.
long
But
way to go, baby. But that does help you pre-phrase
yeah.
that patient.
Hmm.
It's information. If you take it, you can use it to help with getting case acceptance for what they do need. And it's going to give them a better smile in the end. Is it going to be Miley Cyrus? Well, I don't know. But here's what we can do.
It'd be nice, right? Like, I think her smile's gorgeous, but I'm never going to walk into an office and be like, hey, turn me into Miley. My doctor would laugh. He would be like, get out of here.
If you learned something new today, subscribing is the best way to support the channel and keep learning with us.
Would you like to hear more? Follow the link for the full episode.